Welcome to Season 1, Episode 5 of Elemental Health, the podcast where we explore the fascinating world of holistic well-being. I'm your host, Dr. Michael Murray. I'm both a chiropractor that's been in practice for over 19 years, as well as a certified massage therapist and Reiki practitioner. For those of you listening around the globe, we are located in Los Angeles, California. Today's podcast is titled Understanding Chiropractic Adjustments, a deep dive into safety, science, education, and cost. So go grab a warm cup of tea, a fuzzy blanket, and your bunny slippers. Find yourself a cozy little spot, take a slow, deep breath, and let's embark on this fascinating journey together. Before we dive in, let me give you a roadmap of what we'll cover today. We'll start with the basics. What exactly is a chiropractic adjustment? Then we'll address a question I get asked all the time. How safe are these adjustments? We'll explore the fascinating science behind that characteristic pop you might hear during an adjustment. We'll take a deep dive into the education required for a Doctor of Chiropractic degree and how it compares to a medical degree. We'll discuss the conditions that chiropractic care can help with. We'll talk about what to expect during your first chiropractic visit. We'll talk about some tips on how to choose the right chiropractor for you. We will discuss the average cost of chiropractic care. We will learn what the new buzzword concierge chiropractic, the new frontier in personalized healthcare, is all about. And finally, we'll talk about when to seek co-managed care with other healthcare professionals. Comfy? Good, let's get started. What exactly is a chiropractic adjustment? A chiropractic adjustment, also known as spinal manipulation, is a cornerstone of chiropractic care. But what exactly does it involve? In simple terms, it's a procedure where trained specialists use their hands or a small instrument to apply a controlled, sudden force to a spinal joint. The goal is to improve spinal motion and improve your body's physical function. But let's break that down a bit more. Controlled force. This isn't random pushing and pulling. Chiropractors undergo years of training to understand exactly how much force to apply, in what direction, and to which specific joint. Spinal joint. While we often focus on the spine, chiropractors can adjust other joints too, like those in your arms and legs. Improve motion. When a joint is restricted or not moving properly, it can affect your overall health and well-being. The adjustment aims to restore proper motion of joints of the body. Improve function. By improving joint motion, we're not just addressing pain, we're helping your body function better as a whole. Now you might be wondering, why would my spine need adjusting in the first place? Great question. Our modern lifestyles often put a lot of stress on our spines. Sitting for long periods, poor posture while using smartphones or computers, repetitive motions at work, injuries from sports or accidents, sitting in traffic all day, and carrying packages or backpacks are only a small fraction of the daily stress that is put on our spines. All of these can lead to what we call subluxations, minor misalignments of the vertebrae that can cause pain, stiffness, and even affect the function of your nervous system. Subluxation is a sub or partial luxation or partial dislocation. Now let's address a crucial question. Is this safe? I completely understand this concern. After all, the idea of someone manipulating your spine can seem a bit daunting if you're not familiar with it. The short answer is yes. When performed by a licensed and trained professional, chiropractic adjustments are generally very safe. But let's dive a little deeper into this for a moment. Chiropractic care has an excellent safety record, but like any health treatment, it's not completely free of potential adverse effects. Let's break this down. Common side effects. These are usually mild and temporary, lasting no more than 24 or 48 hours. Fatigue, soreness in the areas of treatment, headaches, Think of these as similar to the soreness you might feel after a good workout. It's your body adjusting to the changes that the chiropractor has just made, aligning your spine. More serious complications are very rare, but they can include herniated disc, cauda equina syndrome, a nerve condition affecting the lower back, stroke, in extremely rare cases involving neck manipulation. To put these risks in perspective, let's compare them to other common treatments for back pain. Over-the-counter pain medications. These carry risks of gastrointestinal bleeding, liver damage, drug interaction, and other side effects. Prescription opioids. These carry risks of addiction and overdose. Surgery. This carries risks of infection, adverse reactions to anesthesia, and long recovery times. In comparison, the risk of serious complications from chiropractic adjustments is lower than the risk of taking over-the-counter pain medications. However, it's crucial to note that the safety of chiropractic care greatly depends on the skill and training of the practitioner, proper diagnosis, appropriate selection of patients. This is why it's so important to choose a licensed, experienced chiropractor and to provide a full health history before beginning treatment. Chiropractic adjustments, particularly of the neck, the cervical spine, are often associated with concerns about injury, especially regarding strokes due to vertebral artery dissection. However, the actual risks are relatively low, especially when compared to other everyday dangers. Here's a breakdown of some relevant statistics to contextualize the risks. What are the chiropractic adjustment injury risks? Stroke risk. The estimated risk of stroke from a cervical manipulation is 1 in 20,000 to 1 in 5.85 million manipulations. Most studies suggest that the risk is closer to 1 in 1 million to 2 million adjustments. Serious complications, for example, stroke or vertebral artery dissection, are rare. One review found the risk to be about 1 in 100,000 to 1 in 1 million treatments. Non-serious side effects such as soreness, dizziness, or fatigue are more common but typically resolve within 24 hours. Comparing the risks. The odds of being struck by lightning in a given year are about 1 in 1.2 million. The odds of dying in a plane crash are about 1 in 11 million. The risk of dying in a car accident in the U.S. is approximately 1 in 107 over a lifetime. The risk of being killed by a shark is about 1 in 3.7 million. While concerns about stroke and other severe injuries from chiropractic care do exist, the risk is exceedingly low compared to other common activities. For example, the risk of a serious adverse event from a chiropractic adjustment is far less than the risk of injury from driving a car or participating in high-impact sports. How about when compared to medical procedures? The risk of serious complications from cervical spine surgery is actually higher, with some studies showing serious complication rates between 1 to 5%. The risk of gastrointestinal complications from non-steroidal anti-inflammatory drugs such as ibuprofen is much higher, with 1 in 1,200 users at risk of hospitalization. In conclusion, while chiropractic adjustments carry some risk of injury, particularly to the cervical spine, these risks are much lower than many people think, especially when compared to other everyday activities or even medical treatments. Now let's talk about something that's often a source of curiosity and sometimes concern for patients. That popping sound that often occurs during an adjustment. This sound, known as cavitation, has been the subject of much fascination and some misconceptions. Some people love it, some people fear it, but what's actually happening when you hear this? Here's the science behind the pop. Parts of the joints between the individual segments of your spine are surrounded by a capsule filled with synovial fluid. This is the fluid that people talk about when they say we are mostly made up of water. Craft time. Make 2 fists. Now hold them with the knuckles facing each other in front of you with about an inch of space between them. Now picture both wrists wrapped in plastic wrap, filled with water, and then the whole thing is submerged in a bucket of water. One fist in a spinal segment of your spine, the other fist is the spinal segment above or below. The plastic wrap is the joint capsule, and both the water inside the plastic wrap and outside in the bucket are the same and called synovial fluid. When a chiropractor applies quick, precise pressure to the joint, it creates negative pressure within the joint capsule. When the capsule is at rest, the fluid inside the capsule and outside are at the same pressure. During a chiropractic adjustment, the capsule is slightly stretched, and at this time the pressure inside the capsule becomes more negative with relation to the fluid outside the capsule. This negative pressure causes nitrogen gases that are always dissolved in the synovial fluid, the fluid inside and outside your joints, to be released into the joint capsule. The gases travel from an area of greater concentration across the joint capsule into an area of lesser concentration inside the joint capsule. These gases form a bubble, which then rapidly collapse, producing that characteristic pop sound. It's actually very similar to what happens when you crack your knuckles, and just like knuckle cracking, it's harmless. Fun fact, when you crack your knuckles a few times, it eventually stops making a popping sound. That's because all of the dissolved nitrogen gases have diffused into the joint capsule. There are more collapsed gas bubbles inside the joint capsule than outside. Once you wait about 20 minutes, the gases will diffuse back out. Once the gases are back in equilibrium, you will be able to pop your knuckles once again. Some interesting facts about the popping sound. The sound doesn't always occur during an adjustment, and that's okay. The effectiveness of the adjustment doesn't depend on the sound. Some joints do not have joint capsules surrounding them. The joint between the sacrum and the ilium or hip bone does not have a synovial capsule. You can adjust this joint all day long and it will not pop. As stated before, there is no joint capsule and thus no pressure difference to facilitate the pop. Again, once a joint is popped, it usually won't pop again for about 20 minutes while the gases slowly dissolve back into the synovial fluid. Contrary to popular belief, this popping of joints does not cause arthritis. Studies on long-term knuckle crackers have shown no increased risk of arthritis. There are still chiropractors that will disagree with this. Now let's talk about countless hours of education. Many people don't realize how rigorous chiropractic training actually is. The educational requirements for chiropractors are among the most stringent of any healthcare profession. Let's break down the typical educational journey of a chiropractor. Undergraduate degree, 4 years, usually in a science field like biology or kinesiology, and must include specific prerequisites in sciences and math. Chiropractic college, 4 to 5 years. Rigorous curriculum including over 4,200 hours of classroom, laboratory, and clinical experience. Extensive coursework in anatomy, physiology, biochemistry, and pathology. Specific training in spinal adjustment techniques and patient care. Courses in nutrition, rehabilitation, and public health. Clinical internship in the later years. Must pass all 4 parts of the national board exams to be eligible for state licensure. State licensure requirements vary by state, but typically include a criminal background check and sometimes additional state-specific exams. Most states require ongoing education to maintain licensure. California requires 24 hours every year. Now, how does this compare to a medical degree? There are similarities and differences. Similarities. Both require extensive undergraduate prerequisites. Both involve 4 years of professional study. Both include rigorous coursework in the basic and clinical sciences. Both require passing national board exams and obtaining state licensure, and both involve clinical training. What are the differences? Medical school emphasizes pharmacology and surgical procedures, while chiropractic school emphasizes manual techniques, nutrition, and conservative care approaches. Medical doctors typically complete a 3 to 7 year residency after medical school. Chiropractors may pursue optional residencies, but they're not required for general practice. Medical doctors often specialize, such as cardiology, neurology, and other specialties. While most chiropractors are general practitioners, though some do specialize in areas like sports medicine, pediatrics, and even becoming a qualified medical examiner. It's important to note that chiropractors are recognized as primary healthcare providers in every state in the United States, the military, and many countries worldwide. This means they can diagnose conditions, order x-rays, labs, and special imaging and tests. They can interpret these results and refer to other healthcare providers when necessary. Now that we understand what chiropractic adjustments are and the extensive training chiropractors undergo, let's talk about what conditions chiropractic care can help with. While most people associate chiropractic care with back pain, and indeed it's very effective for that, its benefits extend to a wide range of conditions. They can help with back pain, both acute and chronic, neck pain, headaches, including some types of migraines, whiplash injuries as well as other injuries sustained in a car accident, sciatic pain, frozen shoulder, tennis or golfer's elbow, knee pain, ankle sprains, wrist injuries, and plantar fasciitis, to name but a few. But beyond these specific conditions, many patients also report improvements in overall wellness and energy levels, improvements in sleep quality, reduction of stress levels, and improvement of the function of the immune system. It's crucial to understand that chiropractors don't directly treat these conditions. Instead, we remove interference to the nervous system, thus allowing the body to function optimally and heal itself. Remember, almost every sensory and motor nerve goes either through the skull or the spine. So when the spine is misaligned, the nerves become affected and won't function 100% effectively. Imagine a car running over a garden hose. When the car's tire rolls over the hose, the amount of water coming out the end of the hose is affected by the pressure of the car's tire. It's the same when a spinal segment is out of alignment. The nerves that exit the spine at each level may be compressed by the soft tissue that surrounds the nerve as it exits the spine. If the nerve is compressed, it will not be able to do whatever that nerve is supposed to be doing with 100% efficiency. What to expect during your first chiropractic visit? If you've never been to a chiropractor before, you might be wondering what to expect. Let's walk through a typical first visit. The health history. You'll fill out forms detailing your health history, current condition, and symptoms. The consultation. The chiropractor will review your history and discuss your current health concerns with you. The physical examination. This typically includes general physical exams such as blood pressure, pulse, temperature, and more. Orthopedic and neurological tests. Assessment of posture and spinal alignment and evaluation of joint motion and muscle strength will likely be done. Diagnostic studies. If necessary, the chiropractor might recommend x-rays or other imaging studies like an MRI or blood tests. The diagnosis. Based on the exam findings, the chiropractor will explain what's wrong and whether chiropractic care can help with the problem. The treatment plan. If chiropractic care is appropriate, the doctor will outline a treatment plan that will often include both an office treatment as well as stretching, exercising, and dietary changes to be completed at home. After all, health is a team sport, right? The first treatment, often the first adjustment, is performed during this initial visit. Remember, you're always in control. If at any point you're uncomfortable or have questions, speak up. A good chiropractor will always take the time to explain what they're doing and why. Let's talk about how to choose the right chiropractor. This is a crucial step in ensuring you have a positive experience with chiropractic care. Here are some key factors to consider. Credentials. Ensure they're licensed in your state. You can usually verify this online at the state's Chiropractic Licensing Board's website. Experience. How long have they been practicing? Do they have experience with your specific condition? Technique. Chiropractors use various techniques. Some use their hands exclusively, others use instruments. Some focus on quick adjustments, others on low-force techniques. Just like clinical psychology therapists, there are over 100 different named styles of chiropractic. Techniques like activator method, flexion distraction, Gonstead, Thompson technique, and diversified, to name just a few. Find out what they use and see if it aligns with your preferences. I use the diversified method of adjustment. This is also the most popular and what you probably think of when you think of a chiropractic adjustment or when you see chiropractic depicted on television or in movies. Philosophy. Some chiropractors focus solely on pain relief, others on overall wellness. Make sure their approach aligns with your health goals. Communication style. Do they explain things clearly? Do they listen to your concerns? Office atmosphere. Is the office clean, professional, and welcoming? Insurance. If you're planning to use insurance, check if they're in network with your plan or if they even take insurance. Reviews and recommendations. While online reviews can be helpful, personal recommendations from friends or family are often the best. Remember, it's okay to shop around. Many chiropractors offer free consultations, which can be a great way to see if you're a good fit. Now, let's address a practical concern that's on many people's minds. What is the cost of chiropractic care? Specifically, let's look at what you might expect to pay for a chiropractic visit in Los Angeles in 2024. It's important to note that costs can vary widely depending on many factors such as the chiropractor's experience, location, the specific treatments provided, and whether you're using insurance. I can, however, give you a general range to help you budget. In Los Angeles in 2024, you might expect to pay initial consultation and examination $100 to $200. This usually includes a thorough health history, physical examination, and discussion of your treatment options. It may or may not include an adjustment on the first day. Follow-up visits. $50 to $150 per session. These are typically shorter than the initial visit and focus on adjustments and ongoing care. Specialized treatments, $30 to $100 additional. This might include therapies like electrical stimulation, ultrasound, or specialized adjustments. X-rays, if needed, $50 to $250. Not all chiropractors take X-rays in their office. Some may refer you to a nearby imaging center. Now, these are out-of-pocket costs. If you have insurance that covers chiropractic care, your actual costs could be significantly lower. Many chiropractors in Los Angeles offer package deals or membership plans that can reduce the per-visit cost for patients who need ongoing care. It's also worth noting that some chiropractors offer sliding scale fees or discounts for patients paying cash. Don't be afraid to ask about these options if cost is a concern. Remember, while cost is certainly an important factor, it shouldn't be the only consideration when choosing a chiropractor. The cheapest option isn't always the best, and the most expensive doesn't guarantee the best results either. Focus on finding a qualified chiropractor who you trust and who has experience with your specific health concerns. Also, when considering the cost, it's important to think about the potential long-term benefits. Many patients find that regular chiropractic care helps them avoid more expensive medical treatments down the line and improves their overall quality of life. It's an investment in your health and well-being. What is concierge chiropractic? Let's start with the basics. Concierge chiropractic, also known as boutique chiropractic, is a model of care that prioritizes personalized attention, extended appointment times, and a more holistic approach to your health. Medical doctors may also employ boutique style of healthcare. This model is not unique to chiropractic, so if this interests you, ask your other healthcare providers if they also have concierge or boutique memberships. In a traditional chiropractic setting, you might find yourself rushing through a 15-minute appointment, barely having time to explain your concerns before you're whisked off the table. Concierge chiropractic flips this model upside down. With a concierge service, you're not just another appointment in a packed schedule. You're a valued member of a select health community. Here's what that typically means. Longer appointments. Instead of 15 minutes, you might have 30, 45, or even 60-minute sessions. Comprehensive care. Your chiropractor has time to address multiple concerns, not just your primary complaint. Easy access. Many concierge chiropractors offer their direct cell phone numbers or email access for quick questions or concerns. Same day, next day, or weekend appointments. No more waiting weeks to be seen. Relaxed atmosphere. With fewer patients overall, the office environment is often more calm and inviting. What's included in a typical concierge or boutique membership? Now you might be wondering, that sounds great, but what exactly am I signing up for? Well, each practice is unique, but here's what you might expect from a concierge chiropractic membership in Los Angeles. Regular adjustments. This could be weekly, bi-weekly, or monthly, depending on your needs. Additional therapies. Many memberships include services like massage, acupuncture, cupping, or physical therapy. Nutritional counseling. Some chiropractors include dietary advice and supplementation plans. Fitness guidance. You might receive personalized exercise plans or access to small group fitness classes. Health coaching. Regular check-ins to discuss your overall health and wellness goals. Priority scheduling. Members often get first dibs on appointment times. Extended hours. Some practices offer early morning, evening, or weekend hours exclusively for members. House calls. Some chiropractors may offer home visits to their concierge members. Let's talk about everyone's favorite topic, money. What can you expect to pay for this level of personalized care in Los Angeles in 2023? As with any healthcare service, prices can vary widely based on the specific practice, its location, and the range of services offered. However, I can give you a general idea of what to expect. Monthly memberships. Basic plans, $150 to $300 per month. Premium plans, $300 to $600 per month. Ultra premium plans, $600 to $1,000 per month. This translates to annual memberships fees of basic plans, $1,500 to $3,000 per year. Premium plans, $3,000 to $6,000 per year. Ultra premium plans, $6,000 to $10,000 per year. Now, I know these numbers might seem high at first glance, especially if you're used to the cost of traditional chiropractic care. But let's break down what you're getting for your money. More one-on-one time with your chiropractor. A broader range of services. The convenience of easy scheduling and extended hours. A more holistic approach to your health. Potentially fewer visits to other healthcare providers. It's also worth noting that some concierge practices offer tiered memberships. This allows you to choose a level of service that fits both your health needs and your budget. Now the big question, is this type of care worth it for you? Here are a few things to consider. Your health needs. If you have chronic conditions or complex health concerns, the extra attention could be invaluable. your schedule. If you're always on the go, the convenience of priority scheduling and extended hours might be a game changer. Your health philosophy. If you prefer a more holistic, preventative approach to health, this model aligns well with that mindset. Your budget. While it's an investment, consider the potential long-term savings on other healthcare costs. Remember, health is not one size fits all. What works for one person might not be the best fit for another. It's always a good idea to schedule a consultation with a concierge practice you're interested in. Many offer a trial period or a one-time visit option so you can experience the difference before committing. Concierge Chiropractic is redefining personalized care. While it does come with a higher price tag, for many the benefits of dedicated comprehensive care and extended hours are well worth the investment. As always, I encourage you to do your research, ask questions, and make the choice that best supports your health journey, whether you opt for concierge care or stick with a traditional model of chiropractic care. The most important thing is that you're taking proactive steps towards better health. Chiropractic care: when to seek co-managed care with other healthcare professionals. As a chiropractor, I'm passionate about helping my patients achieve optimal health through spinal adjustments and holistic care. However, it's crucial to understand that chiropractic care isn't always a standalone solution. There are times when working together with other healthcare providers is not just beneficial, but absolutely necessary for your overall well-being. Let's explore some specific conditions where co-managed care is essential. Cancer. If you've been diagnosed with cancer or are undergoing treatment, it's vital to have a team of healthcare professionals working together. While chiropractic care can help manage pain and improve quality of life during cancer treatment, it should never replace conventional medical care. Chiropractors can work alongside oncologists to alleviate pain from cancer or its treatments, improve mobility and flexibility, enhance overall well-being and quality of life. Always inform your chiropractor about your cancer diagnosis and treatment plan to ensure safe and appropriate care. Diabetes. Diabetes is a complex condition that requires careful management. While chiropractic care isn't a treatment for diabetes itself, it can complement your diabetes management plan. Co-managed care for diabetes might involve your primary care physician or endocrinologist managing your medication and overall treatment plan, a nutritionist helping with diet modifications, a chiropractor issues that may arise from diabetes, such as nerve pain or circulation problems. Remember, chiropractic care should never replace insulin or other diabetes medications. Hypertension, otherwise known as high blood pressure. Hypertension is often called the silent killer because it can lead to serious health problems if left untreated. While some studies suggest that certain chiropractic techniques may help lower blood pressure, it's crucial to work with a medical doctor to manage this condition. A co-managed approach might include your primary care physician prescribing and monitoring blood pressure medications, a cardiologist for specialized heart health care, a chiropractor to support overall cardiovascular health through spinal adjustments. Never stop taking your blood pressure medication without consulting your doctor, even if you're receiving chiropractic care. Fibromyalgia. Fibromyalgia is a chronic condition characterized by widespread pain and fatigue. Managing fibromyalgia often requires a multidisciplinary approach. Co-managed care for fibromyalgia might involve a rheumatologist for overall management and medication, a pain specialist for advanced pain management techniques, a chiropractor for pain relief and improved mobility, a mental health professional to address the emotional aspects of chronic pain. Pregnancy. Pregnancy brings significant changes to a woman's body. And while chiropractic care can be beneficial during pregnancy, it's essential to work with an obstetrician or midwife. Co-managed care during pregnancy might include your OB/GYN or midwife for prenatal care and delivery, a chiropractor specializing in prenatal care to address back pain, pelvic alignment, and prepare for labor, a nutritionist to ensure proper nutrition for you and your baby. Always inform your chiropractor that you're pregnant. Remember, your health is a team sport. As a chiropractor, just one player on your healthcare team. Don't hesitate to seek care from multiple providers when needed, and always keep all your healthcare professionals informed about the treatments you're receiving. If you're unsure whether your condition requires co-managed care, ask your chiropractor or primary care physician. They can guide you towards the most appropriate and comprehensive care plan for your specific needs. We've covered a lot of ground today, from the basics of what a chiropractic adjustment is, to the science behind it, the extensive education chiropractors receive, how to choose the right practitioner for you, how much will chiropractic care cost, what is a concierge or boutique practice, and when you might need a team of healthcare providers in your corner. Remember, your health is your most valuable asset. Whether you're considering chiropractic care or any other health intervention, it's always wise to ask questions. Do your research and make informed decisions. Chiropractic care can be a powerful tool in your health journey, offering a drug-free, non-invasive approach to pain relief and overall wellness. But like any health decision, it's one that should be made thoughtfully and in consultation with a variety of healthcare professionals. I'll leave you with a quote from one of the most famous physicians of all, Hippocrates. "Look well to the spine for the cause of disease." Over 2,000 years later, this wisdom still rings true. So take care of your spine, and it will take care of you. Thanks for listening. Until next time, stand tall, head up, stay healthy, and breathe. Well, that's all the time we have for today. Be sure to join us next Friday for our latest episode, Healing Hands, Unlocking the Power of Massage for a Better Life. If you have any topics you'd like me to cover in future episodes, or if you have any questions about today's episode, please feel free to reach out to us through our website at mcmelementalhealth.com or our social media outlets on Facebook or Instagram. There are links to our social media pages at the bottom of every page of our website. This episode of Elemental Health was brought to you by MCM Elemental Health, therapeutic care that transcends. Make sure you visit our extensive website at mcmelementalhealth.com for more information on a variety of alternative healthcare topics. This concludes this episode of Elemental Health. I'm Dr. Michael Murray. Thanks for listening.